Imagine waking up after a fight and discovering that the person beside you has a hole in their skull. Not a crack, not a small cut, a deliberate opening made with a sharp stone, a piece of metal, or a tool that would look completely primitive by modern standards. And the strangest part is this: the person may still be alive. Thousands of years before hospitals, scanners, antibiotics, or sterile operating rooms, humans were opening skulls on purpose. The practice is called trepanation. It sounds like something invented by a horror story, but archaeological evidence shows that it happened in different parts of the world for thousands of years. So why would anyone do it? Was it an attempt to release evil spirits? A treatment for a crushed skull? A desperate cure for unbearable pain? Or did ancient surgeons understand more about the human body than we give them credit for? The answer is not one simple explanation. Trepanation was probably used for several reasons, and the evidence is written directly into the bone. To understand why this procedure appeared, imagine life before modern medicine. A fall from a cliff, a hunting accident, a blow from a club, or a stone launched during a conflict could fracture the skull. A broken piece of bone could press inward. Blood could collect beneath the skull. The wound could become infected. Even if the person survived the original impact, the damage could continue inside the head. Ancient people could not see a brain scan, but they could see a depressed area in the skull. They could notice that someone became confused, unconscious, or unable to move normally after a head injury. They could also watch what happened when a wound was cleaned instead of left closed. That may have created the first practical reason for opening the skull: remove damaged bone, clean the injury, and reduce pressure. But trepanation was not one single operation. In some places, the surgeon scraped away the bone layer by layer. In others, they cut a circular groove and removed the center. Some openings were made with several small holes joined together. The method depended on the tools, the culture, and the person performing the procedure. The word drill gives us a useful mental image, but it is not always technically correct. Many ancient skulls show signs of scraping or grooving rather than a modern rotating drill. The important fact is not the tool. It is the decision to remove part of the skull while the patient was still alive. And that decision was terrifyingly difficult. The scalp could bleed heavily. The bone had to be opened without damaging the delicate membrane beneath it. A cut that went too deep could turn a desperate treatment into a fatal injury. There were no modern monitors to show the surgeon where the blood vessels were. There was no emergency room waiting nearby. Yet some people survived long enough for their skulls to heal. This is how archaeologists can separate a possible survivor from someone who died during the procedure. Fresh bone is rough and sharp. If a person lives after an opening is made, the edges can slowly change. They become smoother, remodeled, and sometimes partially covered by new bone. The skull becomes a record of what happened after the operation. An unhealed opening may suggest that the patient died during the procedure or soon afterward. A remodeled edge tells a different story. Someone endured the injury, the operation, and enough time afterward for the body to repair itself. That evidence changes the entire image of ancient surgery. These were not always random acts of violence performed by people who understood nothing. At least some communities were observing outcomes, improving their methods, and caring for patients through recovery. One of the clearest examples comes from prehistoric Peru. Researchers have studied more than 800 trepanned skulls from the region, covering almost 2,000 years. The skulls show different techniques and different levels of healing. In the earliest group studied, dating from roughly 400 to 200 BC, long-term survival was estimated at about 40%. In later samples, the evidence of survival rose dramatically, reaching about 91% in one period between AD 1000 and 1400. During the Inca period, the estimated rate was around 75 to 83%. These numbers do not mean every operation was successful, and they do not tell us exactly how long every patient lived. They are estimates based on healing visible in the bone, but the pattern is still remarkable. Across generations, the surgeons appear to have become more effective. How could that happen without modern science? Practice is one possibility. A surgeon who made a mistake could lose a patient, while a safer technique could be remembered and repeated. Communities could learn which tools caused less damage, which parts of the skull were safer to open, and how to clean or protect the wound. The injuries common in the Peruvian highlands may also have shaped the procedure. Warfare and blunt force weapons produced head wounds that could require treatment. In some cases, the opening may have allowed a surgeon to remove bone fragments or deal with pressure caused by a fracture. But not every trepaned skull has an obvious fracture beside the opening. Some people appear to have received more than one operation. That creates a second mystery. Perhaps some procedures were used for recurring headaches, seizures, or other conditions that ancient healers connected with the head. Perhaps the operation was combined with religious ideas about illness and the body. In many cultures, sickness was not divided neatly into physical and spiritual causes. A treatment could be practical and sacred at the same time. This is where we have to be careful. A skull can show that an opening was made. It can sometimes show that the person survived, but it cannot tell us exactly what the surgeon believed, what the patient felt, or whether the treatment actually cured the original problem. The popular image of trepanation as simply letting demons escape is too simple. Some ancient people may have connected illness with invisible forces, but the archaeological evidence also points toward real injuries and real attempts to treat them. Ancient medicine was not one universal system. It was a collection of experiments, traditions, observations, and beliefs. There is another detail that makes the procedure more human. A person could not perform a careful skull operation alone. Someone had to hold the patient still. Someone had to prepare the tools. Someone had to watch the wound, provide water, food, shelter, and protection afterward. If the patient survived for weeks or months, other people had to care for them while the bone healed. Every healed skull therefore represents more than a surgeon. It represents a group that was willing to spend time and resources keeping an injured person alive. That matters because ancient survival is often imagined as a competition where only the strongest individuals made it through. Trepanation suggests a different picture. Humans survived serious injury, not only through toughness, but through knowledge, cooperation, and care. In some cases, ancient Peruvian surgeons may even have performed the operation in ways that reduced contamination. Researchers have suggested that open-air conditions, herbal substances, and tools used only once could have contributed to better outcomes. But these explanations remain hypotheses rather than proven facts. The safest conclusion is that technique and experience improved over time, and the story did not end in prehistory. Modern neurosurgery still sometimes requires opening the skull. Today, the procedure is controlled by imaging, anesthesia, instruments, infection prevention, and detailed knowledge of anatomy. The purpose and technology are very different, but the basic challenge is strangely familiar: reach the problem without causing a greater one. The ancient surgeon had no screen showing the brain. Instead, they had observation, touch, memory, and the hard lessons passed down from one operation to the next. So why did ancient humans drill holes in their skulls? Sometimes the answer may have been a broken head and a desperate attempt to save a life. Sometimes it may have involved pain, seizures, or beliefs about what was happening inside the body. In some cases, we may never know. But the healed edges tell us something certain. These people were not simply victims of a brutal ritual. Some of them lived, some recovered, and behind every surviving skull was a patient who trusted another human being enough to let them open the most dangerous part of the body. Long before modern hospitals, humans were already doing what medicine has always tried to do: understand suffering, reduce damage, and keep one another alive. The hole in the skull was shocking. The knowledge behind it was even more surprising. If you want more stories about the strange problems ancient humans solved, subscribe for the next episode.